Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on investigation. The important investigations you have to do for this are lumbar X-ray, EP and lateral view. If you take this simple X-ray, most of the details of the disease will be known. Like, is there any diminished spaces between two vertebrae, or is there any disc degeneration, or any extra bone growth like lipping and osteophytes can be clearly seen in this X-ray. In advanced stages, when there is compression on spinal cord or compression on the nerve root, you can go for MRI. MRI is the best investigation for this. You can get much deeper into details of the disease you are suffering. Along with that, you need to check for vitamin D levels and calcium levels. These are very important. When you have low vitamin D and low calcium levels, this may degenerate the bone much easily. And coming to the other diseases, you have to rule out some other metabolic disorders. Most of the metabolic disorders can cause lumbar spondylosis. You have to check for PCOD, thyroid, and diabetes, and also other diseases like rheumatoid arthritis and gout. All the other metabolic disorders and autoimmune disorders you have to check as well.
Fidicus Homeopathy.